it's Maddie. Welcome back to my channel, and today is a dental hygiene video that will be going up, and I'm going to kind of share what it's like dealing with your first experiences in dental hygiene clinic treating actual patients. Now, this is my second semester of 4 of dental hygiene school, and second, third, and fourth semesters is when you're treating patients and doing your clinical skills and enhancing your skills to become licensed as a dental hygienist. And you will be seeing a variety of different patients of a variety of different ages, periodontal disease, gum disease health, buildup on their teeth as far as plaque and tartar, or as far as you dental hygiene people or technical people, biofilm and calculus levels. And you're going to have so many requirements for biofilm, or I should say not biofilm, calculus, I think perio too. I'm not 100% sure. I'm only in like the first semester of treating patients, but you're going to have a variety of different like requirements you're going to have to meet as far as age groups, to different things you have to do on your patients, to different levels of calculus for sure, in order to advance to each clinic level and be licensed as a dental hygienist. So first of all, your first day in clinic, you're going to be nervous as heck because you're like going to not know how the flow goes, how you get checked, how you sign up, how you do this, how you do that, and you're probably going to be learning all these different things on a patient for one of the first things. Now, I don't recommend ever telling a patient this is probably my first time ever doing this on you. I've not said that ever to any patient I've treated in, as far as like x-rays to actually treating patients in clinic. We did work on each other several times in pre-clinic so that we are prepared to treat real patients in process level 2 or clinic level 2. But at some point you're going to have to get on a real person, and you're going to learn how to do these things, and you might make some mistakes along the way on a real person. However, you got to learn somehow. Become a professional overnight. You got to learn these skills somehow. So you're going to be scared as heck, but you're going to figure it out. And if you have amazing instructors like I do, they will legit help you through as much as they can and give you as much guidance and as much advice as they can, because they're filled with a lot of great experience, because a lot of them, at least in my program, have been hygienists for a long time. So they kind of get how things go. They've seen a lot of different people. They've been in a lot of different mouths. They've had a lot of good experience. So they kind of get what's going on. So definitely you're going to feel scared at first, but once you get used to it, it's going to get better. And this is something I actually told one of my instructors recently, is like, I'm only in week 5 now, and I've seen patients several times, and it's getting easier every time. And I'm not stressing out about this and that. I'm not feeling freaked out. I feel like I get the flow. I feel like I can do this, and I feel like I'm gaining confidence every single clinic session. And it's amazing to feel that. And it's amazing to feel and see that growth and experience as I go, and it's only going to go up from here, and it's such an amazing thing to go through. And the second thing I want to talk to you about, beyond just the nerves and that kind of thing, is that they're going to grade you on a lot of different things, and they're going to be very, very critical of you, because they want us to develop into professional healthcare providers or dental providers. And in order to do that, they're going to grade you on a variety of different things, from how you're doing in your gum tissue assessment, to how you're doing in oral cancer screening, to how you're cleaning up an operatory, infection control. How are you treating that patient? How are you communicating with that patient? How are you communicating with the dentist and the registered dental hygienist that check all your different things? How well are you at detecting biofilm and calculus? How good are you at making a care plan for a patient? How good are you at manipulating different instruments in different areas of the mouth, and different teeth? How good are you at seeing a variety of different ages? How good are you at making arrangements and finding backup plans for patients if you don't have somebody to fill your spot? Finding that backup plan. They're going to grade you on a variety of different things. Your attendance, that's a huge thing too. We have to have so many clinical hours, so don't miss clinic if you can absolutely avoid it, because it may be detrimental to you in your program status. At least in my program, it's very, very detrimental. I believe, I can't remember the exact, I don't even want to think about it, because I don't think it's going to have to worry, but you miss more than so many hours of clinic, you're basically done in the program, because the states require you to have so much clinical hours and treating so many different patients and having so many hours in clinic. So that's one thing I want to say, because they're going to grade you on a lot. And they use TallyVal to grade us. Now, I don't know if I think it's a nationwide thing. I don't really know. But it's basically a big system for dental auxiliary students, like people that are either going to dental hygiene, dental assisting, dentistry. And they grade you on a variety of different things, and they give you like sub-competencies. So like if you've done really well in an area, you get a plus. If you made one little area, you get a check. And if you made a big old mistake, you get a big X. Let me tell you, I've gotten one X already this semester. One, and I'm not going to let that happen again. I overcharted on calculus that sits above the gum line, and I was looking at plaque. Oops. But you're going to make those mistakes, and then the main thing is when you make those mistakes, you need to move on from the mistakes, and you need to learn from them and grow from them. And the best thing I can say, too, is if you learn something in a classroom setting and you can apply it immediately into your clinic, go for it. I actually did this past week on a patient. We learned how to stage and grade periodontal disease levels, and I literally had my periodontology class right before I had clinic in the afternoon, and I'm like, oh, and my patient coming in today I'm going to be finishing up her gum tissue assessment, so I tried it. I got it right. So the best thing you can do is try it, and even if I didn't get it right, at least I'm really trying to apply myself and learn from what I'm learning in the classroom, and applying it to my career is huge. What I'm going to be doing in a clinical setting, in a clinical aspect. So that's a big thing I'll tell you to do too, is as you learn things, either with patient education, to assessing the health of somebody's mouth, to whatever, learning a certain instrument, apply it to that patient. And, if it really helps you to learn that way, go for it. And it's really helped me to see like, hey, this is highly applicable to what I'm going to be doing. Or, yes, this is more applicable to what I'm going to be doing than I thought it was going to be. So definitely take that and apply what you've learned as fast as you can into your clinic settings. It's going to be a huge thing. The next thing is you're going to have a lot of requirements, and you're probably going to have to, like I said, age requirements is one thing, calculus requirements is another thing. But they're going to give you sheets of skill evaluations and x-rays to take. I have most of my x-ray requirements met already, which is nice, but the best thing about it is that I have them met. However, if my patients get prescribed x-rays over the next 10 weeks that I have of this semester, that's only going to boost my grade, and it's only going to give me better clinical experience. And then skill evals are anything from all the different instruments you learn in pre-clinic, and each patient has different requirements, right? So, like if a patient has calculus on an anterior tooth in this deep of a pocket, and it meets your instrumentation eval, get it out of the way. Because they have to meet certain criterion for you to do those evals, and you don't want any of those left over at the end of the semester, because it rolls over to the next semester, and then if you don't complete those, at least in my program, within the first 4 weeks of your next clinic level, bye-bye, you're out of the program. So as soon as you find patients that meet criteria for different skill evals, do them. Now, there are some skill evals you can do on anybody, like probing or exploring or blood pressure, or at least in my program they have blood pressure. Any of those basic ones, like, you can do on anybody, but people that only have, this kind of pocket depth or this amount of calculus, like, you might not be able to do those certain skill evals. So as you do them, figure it out, okay? You need to plan that accordingly. And at least in my clinics, you can only do 2 per session, but if you can do a full 2 in a session, go ahead and go for it. I did 2 in a session, and then I did just 1 this past Tuesday, and probably this next Tuesday I'm going to do 2, if not at least 1. Now, again, it depends on how much time the other instructors have, because they're going to have to be dedicated to other students too and check other students' work also, so you're not the only one in there. But plan on doing your maximum amount of evals each session and plan them out, even if you're not going to do them, because you want to get the idea that, yes, you can do them, and if you don't get that done in the next session, or that clinic out session, do it in the next appointment, because you're going to be seeing your patients for multiple appointments, most likely. And that's the next thing I'm going to tell you. You're not going to get a patient done in the typical 1-hour dental clinic. Why? Number 1, because you're learning, and it's going to take some time for you to figure things out. Number 2, you have to have everything checked by an instructor. So, for example, you have a patient, you go through their gum tissue assessment, you probe them, you check their recession, you do a plaque score, you look at their gingival description, and then the instructor comes in, checks all your work, checks all your probing depths, checks all your whatever. So it takes time to do that. And at the same time, especially as a fairly entry-level clinician, like, they're going to be showing you some different things and giving you some different tricks to kind of help you along with that kind of stuff. So that's why it's going to take several appointments that are going to be a couple hours long. Even a simple patient is going to take that, especially since we're still learning now. As we advance like past midterm here, I should be able to crank out easy patients pretty quickly within 2 appointments. And even still, second year students probably are doing simple patients in 1 3-hour appointment or 2 or appointment and a half, because again, they have to have everything checked too. Even though they're practically almost professionals by now, they have to have everything checked too. So you're going to have to tell your patients, hey, you're going to have to come in for multiple appointments that are going to last a few hours long. And it depends on everybody's level of whatever you're dealing with and how fast the instructors can check that determine how many appointments you're going to have to do. So it's another thing I'm going to stress to you is that find people that can come in for multiple different appointments and that are going to be dedicated to you. However, what I will say is that for those of you that are thinking about helping out your family members and, you know, stuff like that, it's a big thing to like make that commitment. However, you're getting a very thorough dental cleaning. And I actually want to have one of my classmates clean my teeth because I really like the thoroughness and the amount of education we do with our patients and the amount of instruction we can get. And as I said, it's extremely thorough compared to going to a 1-hour dental appointment where they're just quickly going in, going out, and they're done. Like you don't really have time to interact or build a bond or get the education maybe that patient needs or reevaluate a patient's health, because maybe a patient has a difficult time removing plaque on this certain area, and then if you tell them, you know, you can focus on this a little bit more, do a little bit of education, they come back in for the next appointment, and you're like, oh, that's really improved. So you can really see the change pretty instantaneously. You don't have to do a 1-hour appointment, shove everything down their throat, send them out the door, and then you have to reevaluate in 6 months, right? We're going to get to that point. However, my main thing is not to feel like people are getting rushed through a dental appointment. And I feel like that's how a lot of it is now. That not saying that they're bad at dental hygienists out there, but I feel like the dental world is gone to push and go, get as many people in as you can. But what are you really doing for your patients? Like if you're educating a patient, like you really should be giving them the time that they need to get that education to better themselves and better their oral health. And you know what, instead of telling them, you know, you got to do this and this, you might overwhelm them. You got to give them baby steps to kind of like guide them in the right direction, right? So it's another thing I will say. Find people that are dedicated, find people that are going to help you out in this program, and that is going to take a lot of appointments. Have patience while you're waiting for an instructor. It's going to happen to me a little bit. I mean, not like horribly, but it's like I signed up to do an eval and I'm sitting there going, where is the instructor? Like, she should be in here right now. She got distracted a little bit. Almost forgot to do an eval on me. But you know, it was all good. I had patience. You're going to have to find different things to do while you're waiting for a certain eval on a certain part of the dental hygiene process of care. So what I just did is I moved on to my next step, and I kind of just started doing cavity detection, and I did some patient education while I was waiting, like telling her, you know, floss, brush, whatever, blah, 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 on this particular patient. And I was able to do my skill eval, which is super duper nice. And again, as you can tell, I'm being very, very generalized when I'm talking about patients and this and that, because it's HIPAA compliance. I can't say X and X person is coming in my chair, X and X person is doing this, X and X person has this level, X and X person is this. I think I'm being general just to be general. I'm being general to be HIPAA compliant. We want to be HIPAA compliant. And you're going to learn that very quickly. Like, what you say in clinic stays in clinic, okay? What you talk with your patient stays with your patient. And what medical information and dental history that you talk about with your patient stays with you, between you and your patient, and then obviously an instructor too, because they're the hierarchy. Learn to be HIPAA compliant, and you're going to learn to do a variety of different things. You're going to learn the flow of like sterilizing instruments to helping out your other student dental hygiene girls, because we all work as a team. You're going to learn to communicate with other dental professionals. You're going to learn new terminology, and what I really love is what I'm learning in other dental courses is really applicable to what I'm doing in clinic in the moment, and applying it right away is super fun and amazing. And your clinics are going to be long. Your clinics are going to be nerve-wracking at times. However, they go by so quick and they're so enjoyable. Like, I learned so much in clinic, and I love doing what I'm going to do, and it really just emphasizes, like, hey, this is what I want to do for the rest of my life. I want to be a dental hygienist. I want to educate patients on what it's like to take care of their oral health and better their oral health, and all those different amazing things that come with being a dental hygiene student. And as you can tell, I have a big Colgate bag in my bedroom here. I'm not sponsored by Colgate, by the way, but just wanted to point out, any dental hygiene student has Colgate in their room, right? Okay. But I hope this video was rather interesting on kind of how clinic goes. Gave you some general guidelines. Again, I can't be saying, you know, X and X persons in my chair because it's not HIPAA compliant. I can't say blah, 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 blah. But I will say I've treated a variety of different patients so far with a variety of different levels of buildup, with a variety of different levels of understanding and education, with a variety of different health issues, I guess you could say, dental experiences, dental histories, and it's very, very interesting to kind of bounce back and forth between that and get a variety in. And that's what I'm really gonna love about dental hygiene, is like seeing the variety that you get with patients. Like, every patient is different, every patient's needs is different, and it's a nice challenge to try to come up with different, you know, educational type things for your patient and figure things out. So I will say this right now, as far as clinic's concerned, I have all my requirements lined up and in progress, which is nice. All my x-ray requirements are met except for one requirement. I need a separate set of bite wings yet. However, I know a couple people that are due for just a set of bite wings, which is going to be awesome, so I don't have to worry about that. And in the meantime, I'm also thinking of patients I can use for semester 3 or ask about for semester 3, because I kind of know what we're kind of looking for and stuff like that. I mean, they could change some things, but at least I got a general idea of what I'm going to be looking for, and like maybe people that I'm seeing now, maybe they'd be interested in being a recall patient for me in the fall. We can have that, which is super cool. I think we're required to have recall patients, which is, you know, nice because you get to build that relationship with a patient. To get the idea of like seeing people repeatedly, and that's something you're going to see in a dental office, is like you might see multiple patients, you know, same patients every 6 months or 4 months or 3 months, depending on their recall level. So it's kind of cool to build that relationship with that patient and kind of see their progress as they go through their oral health and bettering themselves. So anyways, I hope you enjoyed this video, Dental Hygiene World. Again, the background's kind of busy from my last video if you didn't see. I'm in the same clothes, same background, because I'm filming them on the same day. I don't know if and when they'll go up around the same time, but if they do, great. If they don't, they don't. But this is my bedroom. Kind of like my desk is back here. I've got a lot of other stuff going on my wall, and that's actually my diabetes cabinet. But hopefully I'll talk more about dental hygiene clinic as I go through. I'll definitely talk about semester 2 recap when that's done, but I wanted to give you guys an idea of what to expect in clinic when you first go in, and it's going to get easier, and you're going to really love seeing the variety of patients with different levels of different experiences and stuff like that. You're really going to love dealing with that, and like I said, you're going to be scared at first, but you'll figure it out. I mean, just like anything else, you're scared to start the program, but you're going to learn and grow as a person. Each time you do it, it's going to get a little easier. So anyways, I hope you enjoyed this video. If you did, give it a big thumbs up. Feel free to hit that subscribe button down below. I post videos every single week about diabetes plus more. And until next time, for another video, take care, God bless, be kind, spread positivity, and be thankful. Bye, everyone.